Hello and good evening once again. Dr. Alalade here at Ask the Gynecologist. Tonight is another time where we need to spend time with each other to catch up. Let me tell you something about ATG. The reasons why we do these things every day is that there is power in repetition. There is that power, amazing power in repetition. And the things I repeat, the things that become habit for me, and those things become a lifestyle. And lifestyle is our history. That is why on ATG we ensure that 2 to 3 times a week we come here live to repeat the same things we say it again and again. The reason is that there will be somebody there that needs to hear these things once a while, repeatedly. And there's somebody that has never heard these things before. That person could be you. And that's why we are always here every day with our whole heart saying these things over and over again. Let me tell you something. The first thing I heard this morning when I woke up from sleep was a text from a lady that I posted on this Facebook page, on ATG page this morning. This lady has been trying to get pregnant since 2004. She's about early 40s. In fact, she's been through a divorce and she followed our guidelines and she got pregnant just this morning. In fact, I think she took a while before she told me. She wanted to be sure. You see, she started her journey. She went through a difficult time. In fact, she lost her first marriage because of pregnancy for whatever reason. But this time around, she got started into a relationship again. She put her past behind herself. And let me tell you something. This lady, for the last 2 years, she's been following everything I say back to back. It is not me. I may be a tool, a pencil, a pen in the hands of God, but I'm sure and I believe by faith, God has used me as a point of contact to many women, to many homes, to many families. And that lady was just one of them. And if you're listening to me today, if you're still hearing me today, there's a reason why you're still able to hear me and you're still able to listen to me. Let me tell you something. From the day God designed you as a woman, from that day that you were born on this earth, there's a reason for you being here. And that reason is for you to dominate your environment, to procreate, to bring forth your kind, your own children. There's a reason why apples have seed. There's a reason why yams too have seed. There's a reason why onions too have seeds. And there's a reason why we men, human beings, have seed. There's a reason why the apple bring forth its kind. There's a reason why tomato will not bring forth orange. They will bring forth their kind. And that reason is why you are here. Once God designed you, once God made you, God has given you a reason to exist. And that reason is to produce after your kind, after yourself. There was this last week, I was on this page. Hold on, Rebecca, Erica, Agri. I will take questions at the right time, okay? I know, see, when you go to the market of life, don't go with your need, go with your seed. If you go with your need, everybody has a need. Once we start talking here, the first thing people ask is question. Hold on, don't be after what you can get. Be after what you can give. First things first I need from you is attention. Give me attention. Then I will give you mine. Once it's time for you to start asking questions, I will give that room. But first of all, listen. The things you listen, okay, actually bless you more than the things you want to ask or receive. Learn to listen first of all. In life, you get a lot from somebody by listening. Okay, so first of all, listen to this. Last week I came home up online on this page and I was making an invitation to all our members and to all our viewers. And I said that look for somebody on this group that you can pair with. I received a message from a lady, I think about 2 or 3 days ago, and this lady was saying that, Doctor, I missed that live discussion where you said that we should pair up with anybody that has a difficulty trying to get pregnant. Doctor, can you bring up that discussion again? Because I still want to partake from this. Let me tell you something. On that day, we were sharing together, and I said there's a secret in life. I don't know how it works. And on that day, I even made an example. I said that I don't know how a car works, but what I know is that if I start the car, I just need to drive. I don't need to know how this phone I'm using to talk to you works. I don't even know what are the components inside this phone. But I know if I switch on this phone, wherever you are, you are seeing me, you can watch me, you can hear me. That is all I need. I need to use this tool. So what I'm trying to say is that, you see, there's a secret in life when you wish your neighbor that thing that they need. You wish that thing happens in their life. So if you see a woman on this page, a fellow lady on this page that is trying to get pregnant, see, you need pregnancy. That's okay. Don't worry about yourself. Genuinely, full-hearted and wholeheartedly, out of love, wish that person consistently, pair with somebody and wish that person consistently that thing that you want, that they truly want. Ask God and wish that thing on them, onto their homes. I said on that day, you'll be amazed how God will hear you. You'll be surprised how your situation will change. That thing works. I don't know how it works. I don't need to know how it works, but I just need to know that it works, and I use it, and it works for me. Whenever I'm going through a situation, difficult things for me, I try as much as possible to look for somebody going through the same situation and wish that thing that I want, that they need, ask God to give it to them. And I say it genuinely speaking, and it happens to them. So tonight, before we open the floor for our normal medical talk, before we open the floor for medical questions, before we open the floor for all these things, I want to say, look for somebody on this page that is desiring, that really, really genuinely wants a baby, and partner with them and form a friendship with them, form a bond of love with them, and start genuinely, consistently, every day, bring up their picture on your phone and wish them that God will open their womb, answer their prayer, and turn their situation around. Forget, die to yourself. Forget about yourself for the first time, for the first few days. Do that thing. This thing I'm saying, do it for at least 3 weeks. Genuinely wish, genuinely pray for that person that you want and partner with, that God will bless them with babies. Genuinely. So now, on this page now, look for somebody on this Facebook page, look for somebody on this Instagram page, on this YouTube page, and partner with them and form a bond of love with them and genuinely wish upon them that God will open their womb and God will answer their prayer and God will fill their womb with a baby, and this time coming next year they will deliver their own according to their kind. Wish it upon them and say it every day for them. Pick up their picture and desire that thing for them. You'll be amazed how God will open the doors for you. Good evening, J1 Ultimate. Good evening, Abiola on Instagram. Good evening, Vera Briggs, Sheena Johnson Adoki, Praise Unwe, Favor Obina, Khadijat Hassan, Elizabeth James on Wale. I can see a lot of people are already here. Timule Ajibade, Stella Osaji, Aniti Udo, Sarah Feti, Ngozi Wabuisi, Omolua Love Matthew Paul, Fumilola Olufemi, Anyechi Adejo, Victoria Claire. We have Ngozi Wabuizi, Uma Love Matthew, Onyechi Adejo, Elizabeth Fediba, and everybody coming up live. Grace Idoko, Janet Oluwakemi Omolade, Adibi Mary, Favor Obina, J1 the Ultimate, Precious M Tafang, Adigeb Scott Onyin, Eileen Aikoma, Ajoke Adidokun Aya Obaroye, Victoria Claire Odunla Onifade. If I've missed your names, please forgive me. If I've misspelled or mispronounced your name, apologies. I say sorry. Okonko Chioma Okechukwu, Chioma Ada, Grace Bahajo, Christy Allison, Favor Anointed Aduke. Look for somebody on this page now that needs that baby that you want. Partner with them, form a bond of love with them. 2, 3, form a bond of love with them today now, and wish upon them that thing that you want, that they lack. Wish upon them genuinely. And you see miracles can happen. I mean, doctor, but I also believe in God. Muhogalu Chioma, Shina Johnston Adokie, Imos Okeke, Dada Oluwafemi Motunrayo, I love you too, my sister. Anehile, Christina Clement, Faith Raymond. It does not matter whether you're Christian or Muslim, you can partner with anyone, because we are all from the same stock. And God is our Father and a Father to us all. It does not matter what religion you believe. It does not matter where you come from, your tribe or your nation. You can partner with anybody. In fact, the further apart, the further afield you go, the stronger your faith, the stronger your demand upon the power of God to answer your prayer. You see, the body is the body, the mind is also the mind. Everything is housed in this our one body. You see, the mind is ageless, but the body diminishes as we grow up every day. But your mind is limitless, your mind is boundless, your mind is ageless, and your mind is genderless. You see, partner with anybody close to you, far from you, pair with them now, and you see signs and wonders happen in your life. Trust me, I know it works. Whether you believe in Allah, whether you believe in God or Jesus, whether you believe in any other God, it does not matter. If you cut me, you cut you, you only see blood come out, because we are one and we are all the same. Black, yellow, black and white, purple, green, whatever your color, we are all the same. Pair with somebody and form a genuine bond of love. ATG has formed bonds of love in many homes. God has used ATG to change lives, and it will not stop here, it will continue. This morning, that message came to me. I was happy for this lady. And tonight, before I came up live here, I was on the phone with another lady. She was trying to get pregnant all the while, and today she delivered safely. And another lady texted me again. She delivered today. I've not spoken to her. She's one of our ATG members, wonderful lady from the southeastern part of Nigeria. Her name is F. I'll give you initials of her name, FA. You know who you are. Thank you. God bless you, and God bless your home, and God bless this arrival of baby to your family. May God blessing sit upon, arrive upon, and live with you in your home. I say, so shall it be. Hello, Emanuela Nemerem. Thank you so much. Dada Oluwafemi Motunrayo, Shina Johnston Adokie. Domsy Touch, I am official something. Glow Fast Travel. Hello on Instagram. How are you? And good evening. Ungo Bridal. Adibi Mary. Partner with somebody. If nobody's ready to partner with you, partner with yourself. My name is Dr. Lalade, and I finished from University of Lagos. I'm a medical doctor. I finished in April 2002. And I've been working in Ops and Gynae since 2003, since I came to UK. That makes it about, if I'm correct, about 18 years, plus or minus, all things being equal. I have a bit of idea of Ops and Gynae. I've been doing that for a long time, and maybe, if possible, I know a bit more. The need, you see, is that we know that there's a gap between doctors and patients in Nigeria. And ATG as an online platform has been designed. In November 2015, we came to light to fill that gap, educational gap between patients and doctors, and to bridge that gap as well, and to also educate our women population, most importantly, even the men, to understand women better medically, as I so to say. The solution is ATG, where we push out this information online every day to ensure that people are able to know better about their body, and in so doing, improve healthcare access, provision, and increase value to Nigerians, to people in diaspora, and to other African nations as well, all things being equal. Once again, ATG is been existing since now almost 7 years now, and we've done a lot through you, and by God, we've been able to establish a laboratory for infertility tests and also an IVF center. And let me tell you something, we're just starting. We're not stopping yet. We're just starting. We'll continue until this vision is carried by someone else and continued even after we are gone, or whatever, if God says so. That is my desire. My desire is to see women desiring to get pregnant, getting pregnant whenever they want to, as many times as they want to. My joy is to see homes brought together. I've been in a relationship before, and I understand how families can be torn apart because of children, by children, or for no children. And that is why consistently what drives me on ATG is that joy that I see on people's face. Let me tell you something. If a person miscarries, a person does not get pregnant or miscarries, I'm not happy with it. I pray as much as I can, but there's more. There's so much I can do. But my joy, my hope, my desire is that I still continue to preach this gospel of gynecology to ensure that lives are changed and permanently blessed. If I can't make any addition to you in your life to make it better, my own desire is to leave you as you are and not make your life more miserable. I don't want to. My plan is always to ensure that once I come in contact with you, the moment I leave you, you are a better person. Now, this night, Monday, December 6th, the first Monday in December, we're starting on another roll. We are starting on another momentum. We are starting on another fire-driven momentum. So this month is still this year. When we started this year, 2021, the year when COVID ravaged the world, last year and this year, we believed, I know, and I have no doubt that your situation shall be different. Let me tell you something. We might not be able to give answers to everything you want or desire on this our platform, on this our page, consistently. But one thing I know is that we would not stop until we are able to make a change. ATG is free. ATG is an open platform. You come in there, you settle down, you soak into us, you partner with us, you listen to the things we say, and watch your life, your story change. Change, change. Positive change. Now, let's open the floor for questions now. Let's open the floor for gynecological questions, for antenatal questions. I saw a question at the beginning today. A lady was talking about cephalic presentation in, I think, 15 weeks. Okay, let me tell you something. Your baby is head down, we call it cephalic. If the bum is down, we call it breech. If it's lying across, we call it transverse, lying across. If it's lying slightly angulated, we call it oblique lie. Your baby can have any presentation, head down, bum down, at any point during pregnancy. The most important thing is that once baby is more than 36, 37 weeks, their head is down. Okay, before 36 weeks, before 37 weeks, baby can be head down or bum down. It doesn't matter. Before 36 weeks, before 37 weeks, babies are like clothes in the washing machine. They keep rolling and rolling and rolling and rolling. Because your baby is head down today at 26 weeks, does not mean that it will be head down tonight while at 26 weeks on the same day. They keep changing. So don't panic if you go and do scan at 20 weeks, 15 weeks, and they say the baby's head is down or not down. It doesn't matter. When it matters is once you are above 36 weeks, 37 weeks. That's when it matters. Okay? Very good. You see, this year, if you've been trying to get pregnant this year and it hasn't happened yet, now listen to me. From today onwards till 31st December, every day you have sex, let it be every other day, every other day. Have sex every other day or every two days. As far as there's no bleeding, as far as there's no period, what you need to do is to have regular sex. Regular sex. And whenever you are having sex, use pre-seed lubricant. Pre-seed what? Lubricant. You all know how to get pre-seed lubricant. If you don't know how to get pre-seed lubricant, just call ATG office. Nike or Chima will tell you how to get the lubricant. Okay? Every time you have sex, each round you go, put and smear that lubricant on your husband's penis before he puts his hammer, before he puts his clutch, before he puts his brake inside your this thing, and consistently do it. Even if you're having different round, okay, on that Maracana Stadium, always apply it fresh and have regular sex, okay? During that piece of lubricant, what does this lubricant do? It makes your vagina conducive. It makes your vagina friendly. It makes your vagina welcoming to sperm and allow sperm to travel fast as much as they can. PC lubricant, you can get it on Amazon or Jumia, or if you want, you can get it from our office in ATG at Lagos. Okay. There's a question here about epidural on Instagram, and this lady is saying that, good evening, doctor. How long does it take for epidural to get ill? Epidural is a form of anesthesia we give to people by putting a small needle in the backbone, lower spine there. It goes in there, we put an injection there, and it keeps you numb from your tummy area, belly button area down during delivery or during operation for delivery. Usually within 12 to 24 hours, your sensation of pain will get back. Okay, that is it. Okay, you're able to move around, walk around. In few cases, people do have dull headaches, what we call post-dual epidural headache, and it can be very uncomfortable. There's a way the anesthetists treat that. They do some blood patch, which they do. Okay, very easy. But that area will heal within a week. Okay. However, once epidural has been removed, there's a catheter we call epidural catheter. Once it has been removed, between 12 to 24 hours, your pain sensation is back and you're able to move around. Before your pain sensation is back, before your muscle is back to working action, we leave a catheter there to empty your bladder for you. Okay. There's a lady here saying that she's just hearing about the lubricant. Please, can one of our moderators give her this lady this link to get our office tomorrow? Okay. Now, on ATG here, what we talk consistently about is about better antenatal care, what to do to improve your chances of getting pregnant. Chiefy Gold, Betty, how are you? There's a question here, Doms the Touch. You had high prolactin, but now it's normal. Do you need any fertility medicine to boost your ovulation? As far as all your other hormones are perfectly okay, as far as your prolactin is perfectly normal, what you need to do is to have regular sex. And during having regular sex, okay, first of all, if you're partnering with anybody, don't put your number on the screen. Just forward your number to them and partner with them, but don't put number on the screen. And don't send anybody any money. Don't send people your partner money. We're talking about bond of love and praying for somebody, not to go and send them money. So be careful. Don't say that we somebody duped you here. Okay, please don't do that. Be careful with your numbers. Okay. Now, once your prolactin level is normal, this is for Doms the Touch. Okay, I'll suggest that medication you're taking that kept it normal, you stay on it. You stay on it. Once you get pregnant, you can come off it. Okay. Now, as far as your other hormones amongst your tests are okay, there's no other medication you need. This lady that delivered today, that I was measuring at the beginning, she also too had high prolactin. She got it treated, she got pregnant, and she delivered today. So once your other hormones are perfectly okay, prolactin is the one that is not normal, is brought down to normal, you're okay and you're good to go. Okay. Debbie Peter, how are you? Good evening. Thank you, Ukaya Adekunle. Thank you, Jenny Abe. So let's continue our discussion tonight. Now, Ajara Issa Zubar, welcome to ATG. And Stella Omozorike, thank you so much. Nana Yaselva, J1 the Ultimate, thank you. Now, if you're a member on ATG, you should know what the womb is. You should know what is the difference between the womb, the tubes, and the ovary, the vagina, the cervix. The cervix is the part of the womb that opens into your vagina. The cervix is the neck of the womb. That's why it's called cervix. Cervix is called neck. Anything cervical region in Latin is neck. That's what we call the cervix, which is the neck of the womb, cervix. Okay. When you put the womb like a pear, the womb is actually a pear-shaped structure. Okay, the womb is like a pear, and that pear, if you've seen pear before, this is what pear looks like. Let us see if you can get this on YouTube. Okay, this is what a pear looks like. Okay, this is what a pear looks like. Okay, like that. Okay, and that's a small neck. That's the same way and what a womb looks like a pear. Okay, so that is the neck of the pear. Okay, and that's the cervix. Okay, that's the part of your womb that opens into your vagina. Okay, and that is your womb. See, that is the womb. The womb is this one. Okay, that's this one. Okay, and that womb usually normally has two tubes connecting to it. Two tubes connecting to it. Okay, two tubes connecting to the womb. Two tubes that connects and enters into the womb. Okay, and below the tubes you have the ovary. This one, ovary. This ovary was sliced open. Then we got this one. That's the ovary. The ovary must release an egg to move into the tube, okay, to get into the womb cavity for you to get pregnant. Okay, 5 things I always say must happen to get pregnant is, first of all, you must have a womb. You must have womb and ovaries. We scan you to check that you have a womb, you got an ovary. Number two, you must be having regular sex. Regular sex every two days or every 3 days. The only time you're free from sex is during period. If you're having sex during period, it's not for pregnancy, it's just because you love it. Okay, and sex in period can be a bit messy, but if you like it, it's up to you. But the only time you're free from sex for the purpose of getting pregnant is only during period. So regular sex, okay? If you're not having regular sex, it's not good enough. You must be having regular sex, and you must use the pre-seed lubricant during sex. Pre-seed lubricant, I already said it, it makes the vagina conducive for sperm transport. So what? You must have a womb and ovary. 2, you must have good sex, regular sex. And number 3, you must have good sperm. The sperm count must be perfectly okay. Number 4, you must what? Have no blockage in your tubes. And number 5, you must be ovulating. So we do all the tests we do for infertility, they center around these 5 things to ensure that they are all working well to achieve pregnancy. If everything is okay, your tubes are not blocked, you're ovulating, but you're not having sex. You always say you're praying, you're fasting, you can't have sex. You're praying, you're fasting, you can't have sex. My brother, pregnancy won't happen, no. There's no miracle there. You must have sex to get pregnant, and sex is not a sin. If you come to our old sex master classes, we do once in a while, some Fridays back, sex is not a sin. So if you marry, you should have sex. So if you don't knock each other, belle no go happen, no. Okay. The glory of a woman in Africa marrying, the glory of a man married is that, first of all, they must produce babies. Okay, it's African culture. I didn't design it. I just know it is so is there. So you must have regular sex. And if you're having sex every other day using pre-seed lubricant and no baby is there, check your tubes. Check that you're ovulating. Check the sperm count. Okay. What causes regular miscarriage? Infection, placenta placenta implantation failure, okay, chromosome abnormalities. In most cases, if you have a recurrent miscarriage, we must do a barrage of blood tests, what we call recurrent pregnancy blood test, to know why you're having this recurrent back-to-back miscarriage all the time. We must do this test. We must scan you. We must do hysteroscopy to look in your womb cavity. We must even take samples of that miscarriage and check the chromosomes with your chromosome and with your husband's chromosome. Maybe there's something wrong with your chromosomes causing this miscarriage. All this must be done to know why you have a miscarriage. Doctor, you've been taking duphaston. Can you still insert? See, duphaston is progesterone, and cyclodest is progesterone. That's enough. If you're taking cyclodest, it depends on what you're taking it for anyway. If you're taking it for early pregnancy, like from time you're pregnant to 12 weeks, you can take it. Cyclodest is enough. If you're having a current miscarriage and you're already pregnant and you're put on cyclodest, it's okay. You don't have to now put duphaston. They're all doing the same thing. You said you've done a scan at 15 weeks, your baby's cephalic presentation is normal, okay? And even if your baby is breech at 15 weeks, is normal. There's nothing wrong at that stage. If your baby is cephalic or breech at 15 weeks, it's okay. Ovarian cyst does not stop you from getting pregnant. However, if your ovarian cyst, okay, has blocked your tube, if your ovarian cyst has damaged your tube, then it can affect you from cause you not getting pregnant, okay? Doctor, your husband said his uncle said until 3 months of pregnancy, no sex, it can cause miscarriage. Well, I don't know about that, okay? Sex does not cause miscarriage. But however, if you think you don't want to have sex because you're pregnant for the first 12 weeks, it's up to you, okay? If you think you've had baby and you're pregnant and you don't want to have sex again, it's up to you, okay? But sex does not cause miscarriage. However, if you've been told that your placenta is very low, if you've been told that you have placenta previa, okay, in such a case, we say don't have sex to prevent you not bleeding. Because if you have placenta previa, we call it grade 3, grade 4 placenta previa, that is covering your cervix, okay? Having sex may provoke bleeding, okay? But if you've done a scan and on your scan, your placenta is not low, then that's okay. You can have sex. There's nothing wrong in having sex in pregnancy. I can tell you, there's so many women that are pregnant now, and they're having sex right now with their husband. So it's not a problem. You can have sex during pregnancy, except your placenta is placenta previa, placenta is very low, then we say don't have sex in pregnancy, okay? Please take to heart. What does progesterone mean? Progesterone is an hormone produced by your ovary to work to make your womb ready to receive pregnancy. How can you normalize progesterone? What is your progesterone, first of all? Okay, that's what we know. If your progesterone is between 18 and 20, it's okay. In fact, if your progesterone is more than 10, about say between 18 and 20, in most cases, it's okay. Hello, Salma Moore, Mrs. Elrose, and Annabelle Michelle. How are you? Good evening and welcome once again to ATG on Instagram. ATG is also live on YouTube. We are publishing simultaneously on YouTube now. We are on YouTube Live, we are on Instagram Live, and we are on Facebook Live. Okay. I made mention of the fact that of those 5 things, and that will be hope. Our office address for lab test or IVF is below you. Follow the information there. Good. Now, when we made mention of the fact that you need to know that you're ovulating, there are some hormones that are produced by your ovary that work on your womb to get your womb ready to receive egg being released from your ovary. Those hormones include progesterone, estrogen, prolactin, AMH, and all that. These hormones are very important and very vital. We check them to know if you're ovulating and if there's any hormonal imbalance. Prolactin hormone is very important because if it's high, it will make your ovaries not to ovulate. And you know ovulation is essential in getting pregnant. We need to check your AMH, which is a very, very good indicator of your egg reserve. That's the best we have. The AMH does not count your eggs, but the AMH says if you have enough eggs, your AMH hormone level should be this high. Once it's usually above 1, I'm happy. In most cases. Now, what else? We check your LH hormone. The LH hormone is very important to know in most cases where if you're above 40 or above 45. If your FSH, okay, hormone is more than 30 on 2 occasions apart, and those 2 occasions are more than 6 weeks or 6 weeks minimum, your FSH is more than 30, it makes us know that you're probably not ovulating anymore. FSH is very, very important whenever we're doing tests. A lady came to me yesterday, registered for the premium services, and she's never had period for almost 5 years. She's about 51 years old. So I told her that she needs to do FSH hormone and AMH at least of all the hormones that we have, basic hormones for getting pregnant. I'm hoping she'll get me the result. And the reason why I've chosen AMH and FSH for this lady to start with is because she's above 50. She's not had period for almost 5 years. I want to know if she's still ovulating. If she has FSH more than 30, I will know therefore this lady is not ovulating anymore. She needs IVF and she might even, and obviously she needs egg donor anyway. If the AMH is very, very low as well, it gives me the indication that probably she's got no ovarian reserve left. Now, these things are very important. We don't do them just because you just wanted to spend money. We do them because there are so important. There are many hormones in the body that you can check for about getting pregnant, but we've chosen only these 5 for simplicity's sake. There's also nothing wrong in us asking to check for the tubes. Even if you've had baby before, you've been pregnant before, there's nothing wrong in checking if your tubes are okay. The reason is if you're ovulating and your eggs cannot pass through your tubes to get into your womb, you're not going to get pregnant. That is why there's nothing wrong in your doctor asking you to do HSG. Even if you've been pregnant before, suddenly you can't get pregnant again 4 or 5 years down the line. Why can't we do HSG? I've been pregnant before. They said it causes pain. It might cause pain for some people, but I have so many people too that it doesn't cause pain for them, especially if you take some painkillers before going for the HSG, especially if you understand what you're going to do, especially if someone carries you along. There's no anxiety, there's less anxiety, there's little anxiety when going for the HSG. HSG might even be a way for you to unblock your tubes if there's any small blockage there. But if your tubes are damaged and they're totally blocked, HSG will not unblock them. HSG is not designed to unblock tubes. HSG is not hysteroscopy. HSG is not hysterosonogram. HSG is an X-ray test where we push in a dye, contrast dye, into your womb cavity, spills into your tubes, and then spills into your tummy. And we take an X-ray on what we call fluoroscopy technique to see the fluid, the dye, going through your womb and coming out of your tubes into your tummy. HSG is very important. If your tubes are blocked, then we have to discuss how we can make things better to get you pregnant. HSG is an X-ray test, hysterosapingogram. Hysterosapingogram is an X-ray test. Not all labs do it, but if you get it done, it might be a game changer. If you're pregnant, okay, blocked tubes does not cause miscarriage. Blocked tube may make you not to get pregnant, but if for any reason, maybe through some miracle or through IVF you got pregnant, despite the fact that you have blocked tubes, it does not cause miscarriage. Blocked tubes does not cause miscarriage. Okay? Blocked tubes does not cause miscarriage. All right? Can having only hysteroscopy without laparoscopy be effective? It depends on what is being used for. You can have laparoscopy only. You can have hysteroscopy only. It depends on what we are looking for. And we can even do both together depending on what we are looking for. Okay? You don't have to have both. As far as we know what we are looking for, it does not matter. Okay? All right? On Clomid, you did transvaginal scan, but your period came later, lasted only 2 days, not as heavy. It could it be from Clomid? Yes, it could be from Clomid. It could be from Clomid. Please, doctor, what causes delay after HSG? Why did you go for HSG in the first instance? Because there was delay, isn't it? So there's nothing causing delay after HSG. The HSG is just a test to know if your tubes are blocked. So the HSG is not causing delay. You went for the HSG because there was delay. If there was no delay, you'll be going for HSG. Somebody that does not have delay does not go for HSG. So HSG is not causing your delay. The delay was there. You just did HSG. Okay, so leave HSG alone. Okay, HSG was done to know if there's any blockage. Doctor, please, what's the best solution to fibroid? To remove it through surgery. Through surgery. Through surgery. Okay. Shegilola Instagram, how are you? And good evening, and welcome to ATG Instagram. Thank you so much. Right. Thank you, Omowumi Oduwole Aderongwe. Thank you so much. Jennifer Onuga, she's asking for what is the normal morphology level? Normal morphology level. So hold on, we'll talk about that shortly, about sperm. Okay, just hold on. We'll talk about sperm count shortly, okay? When you say morphology, I hope you're talking about sperm though, because my thinking that you're talking about sperm. How can you boost FSH and LH? I honestly don't know. I honestly don't know how you can boost FSH or LH. I don't know how to boost FSH or LH. Hello, Adefunke, and thank you so much for joining in today again. God bless you, my sister. Welcome once again to ATG. So, Jennifer Undukuba, are you talking about semen analysis, please confirm. Can fibroid cause miscarriage? Very, very unlikely. Very, very unlikely. Fibroid might cause infertility because if the pregnancy implants on the location of the fibroid in the womb cavity, that is, if the fibroid is in the womb cavity, that might cause infertility. Fibroid too can cause miscarriage, okay, but it's very, very rare. And that is if the pregnancy implants on where the fibroid is. Okay. Now, whenever we talk about sperm count, there are a lot of factors we look at when we talk about sperm count, about 6 of them. First of all, we look at the total sperm count in the ejaculate, and we look at it per male. Okay. Usually, we want there to be at least 40 million or more. 40 million or more sperm in that drop of sperm. That tiny drop. We want at least 40 million or more. We want your ejaculate volume to be about 1.5 mils, okay, to around 7 to 8 mils, okay? That's enough. Number one criteria, we want the sperm count to be between 40 million or more per mil. Sperm count should be at least 1.5 million to 1.5 mils to 7 mils, okay? And the sperm concentration, we want at least 15 to around 260 million per male. Motility, at least 40% should be moving. And when we say motility, we want forward progression. We don't want some sperm looking sideways, running here, running there. They move forward progression. That's what we want. We want there to be at least 40% or more. And then we talk about progressive motility, 30% or more. And the sperm morphology, that is the normal one, because there are many abnormal sperms, okay? Some can have 2 heads, small tail, short tail, and no tail. We want the normal ones to be at least 4% to 50%. And if they cover these angles, we are happy. We are happy and delighted. Esther Labisi, your LH FSH is okay. Your prolactin is slightly high. It's not too high, but it's slightly on the high side, okay? I'll suggest you repeat your prolactin test in 4 to 6 weeks' time, Esther, to check it again. Does heavy flow block blood? I don't know what that means. How can I go for hormonal test without period? You use Primolute, still no period. If you've used Primolute and still no period, talk to me. I'll tell you the medication to take, the combination to take to make you have and induce your period and go for your hormonal test, okay? We can get your period started so you can go for your hormonal test, okay? Doctor, what is the best way to stop menstrual pain? Option will be to give you some painkillers. Another option is to stop your periods entirely and stop periods entirely. Another option is to give you contraceptives, okay, which can help to space out your period, okay? I'm Apostle Yusuf, thank you. Labski Baby, thank you on Instagram. Morgan Keji, Orilape, I hope that answers your question, please. So you can use painkillers, you can use contraceptives, you can use medications to stop your period entirely. You can also use Mirena coil as well to reduce pain. But most of this medication will make you not to get pregnant too. So decide on what you want and your reproductive plans, okay? What causes period delay for 2 months? Probably hormonal profile test. Okay, maybe stress, but it's likely to be hormonal profile test, or you're pregnant. So the first thing to do tonight is do a test of pregnancy. Abosted day, Ajoke, Okitola. You've not seen your period for 2 months. First of all, do a test of pregnancy. Then also, next thing is to check your hormonal profile tomorrow. Okay. Good evening, Moses Abu 550300927. My number is on the screen. Talk to one of our members. Our moderators will give you my number. Okay. Cheese Maurice KK. You want to have a chat with me, go through the premium services, and I'll be there chatting with you live within an hour. Thank you guys for being here today. I really appreciate you. Hope to see you again tomorrow. God bless you. My name is Dr. J. Alalade, and I'm one of your team members at admin at Ask the Gynecologist, your one and only truly. I'm so happy to be with you today. I love you all, and most importantly, I love myself too. See you soon, and have a wonderful day and week as well. Bye-bye.